Preoperative Anesthesiology Evaluation, a comprehensive guide on assessing and optimizing patients before surgery. Welcome to today's episode of the Everything Surgery podcast. Today we discuss the preoperative anesthesiology evaluation. In this session, we'll take a thorough look at how medical professionals assess and optimize patients before surgery, ensuring the safest possible outcomes. Whether you're a healthcare provider, a medical student, or simply curious about what goes on before an operation, this episode will walk you through every critical step. Introduction. Let's start by understanding what preoperative anesthesiology evaluation really is. Before any surgery, it's essential to evaluate the patient's current health, manage any existing medical issues, and develop a personalized anesthetic plan. This process reduces the risk of complications and leads to better surgical results. Objectives of preoperative evaluation. So, what are the main goals? Here's what providers are looking to accomplish. Assess a patient's readiness for anesthesia and surgery. Identify and optimize pre-existing medical conditions, such as heart or lung disease. Predict and address anesthetic risks, including airway challenges and drug allergies. Explain anesthetic options and obtain informed consent. Order necessary lab tests and specialist consultations. Offer clear preoperative instructions regarding fasting and medications. The evaluation process. Let's break down the core parts of the evaluation. Patient history. First comes a detailed discussion with the patient, covering medical background, heart, lung, neurological, endocrine, kidney, liver, blood, and digestive health. All of these matter. Surgical history, prior procedures and any anesthetic complications. Medications, especially anticoagulants, blood pressure medicines, diabetes medications, and herbal supplements. Allergies and adverse drug reactions. These must be identified up front. Family history, genetic conditions like malignant hyperthermia. Social history, smoking, alcohol, and substance use influence anesthetic planning. Functional capacity, measured in METs. This helps predict heart risk during surgery. Physical examination. A hands-on assessment follows, focusing on airway, predicting intubation difficulty using the Malampati score, mouth opening, and neck mobility. Cardiovascular system, checking for murmurs, arrhythmias, or heart failure signs. Respiratory system, listening for wheezing, crackles, or reduced breath sounds. Neurological status, cognitive function and nerve issues, especially if regional anesthesia is considered. Preoperative investigations. Not all patients require every test, but common investigations can include blood tests, CBC, electrolytes, renal function, coagulation profile, especially for those on blood thinners, ECG for patients over 50 or with cardiac risk factors, chest X-rays, echocardiograms, or lung function tests if indicated, HbA1c for diabetic patients. Risk stratification. Risk assessment tools guide decision-making. Here's how it works. ASA Physical Status Classification. This system grades patients from Class I, healthy, to Class 6, brain-dead organ donor, indicating increasing surgical risk as the class number rises. Cardiac risk. The Revised Cardiac Risk Index, RCRI. High-risk surgeries and factors such as heart disease, stroke, kidney disease, and diabetes are considered. Patients with 3 or more RCRI factors may need extra cardiac testing. Pulmonary risk. Chronic lung issues, sleep apnea, and a history of smoking elevate risk. Strategies like smoking cessation and bronchodilator therapy help mitigate these dangers. Preoperative optimization. Once risks have been assessed, the focus shifts to optimization. Cardiovascular. Control blood pressure, optimize heart medications, and adjust fluid management as needed. Pulmonary. Ensure asthma or COPD is well managed. Encourage CPAP use for sleep apnea. Diabetes. Preferable to have HbA1c below 8%. Adjust insulin or oral medications before surgery. Anticoagulation. Manage timing of medications like warfarin or DOACs, with bridging therapy for those at high thrombotic risk. Fasting. Adhere to ASANPO guidelines. Clear liquids up to 2 hours before, longer for solids and fatty foods. Informed consent and anesthesia planning. It's vital to discuss options, general, regional, or sedation, along with their associated risks, and to document patient preferences. Special populations. Let's not forget groups with unique needs. Elderly, higher risk for delirium and medication sensitivity. Children, assess for congenital issues, Parental presence may ease induction. Pregnant patients. Special considerations for drugs and positioning. Morbidly obese patients. Attention to sleep apnea, difficult airway, and clot risk. Documentation and handover. Summing up, the evaluation is crucial. Document risk, preparation, and your anesthesia plan, and make sure to communicate effectively with the surgical and anesthesia teams. Conclusion. A comprehensive preoperative anesthesiology evaluation is vital to patient safety and surgical success. Through careful history taking, physical examination, risk analysis, and targeted optimization, anesthesiologists help minimize complications and improve recovery. Thank you for tuning into our deep dive on preoperative anesthesiology evaluation. If you found this episode helpful, don't forget to like, subscribe, and join us for more content on surgical preparation and patient care.